Bird poop's not evident on me, is it?
Good morning, everybody. Welcome back to the Buttonwood Park Zoo. It is a cloudy but warm day here in New Bedford, Massachusetts. We're so excited to have you guys joining us. If you saw the little teaser that we put out about an hour ago, you know that we will be doing something a little different again today. We're going to be meeting with a different kind of staff member than a keeper, but equally important. Hi, Hannah. We were so excited to have you on the virtual zoo crew as well. That was really fun. I'm excited for Friday. Good morning, Diana. So I'm going to introduce you to Dr. Lipanovich, our veterinarian on staff here at the zoo. We are just outside our vet clinic area, and she's going to actually take us on a little tour of our clinic, and she has to head on inside.
Hi guys, Lipanovich. I'm the veterinarian here at Buttonwood Park. I'm a full-time veterinarian, so I am here even though everybody else is on part-time. I am an essential staff member, so I am here full-time. And still here full-time even during this crisis. So I'm going to give you a nice little tour of our little hospital. I have a few friends in here, so be kind, and during these times when I am by myself, I do need some friends.
So I'm getting some weird things saying that maybe get closer, we'll be good. Hopefully you guys can see us.
Alright, so here we are in the entryway of the hospital. As you can see, we have quite a lot of supplements here. That's because we have a lot of what's called geriatric animals, or older animals. So this is just a small sampling of some of the supplements that some of our older animals get on a daily basis. And then through here is our pharmacy. Now, as you can see, we have Cody the koala, who is here to help me count out medications for some of the animals. This is an antibiotic, and this is just a small sampling of some of the medications that we have here on zoo grounds. And then we'll come on this way. Here's our schedule. Most of the time I do try to write it up on the board so that as keepers come in and out, they can see what's on the schedule and kind of have an idea of when to be prepared. Then we'll come this way. This is my office. When I am not here, Sammy the sloth is always helpful and provides good management control for everybody. Very informative. Tends to be a little slow though in getting back with people. And in here is our x-ray. So come on in. So this is our sweet little kitty who is in for an x-ray. This is a nice soft little V that we can just kind of lay them in. It helps aid in positioning some of our patients. And then this is an actual x-ray that we have from one of our possums who is in for a dental exam. And this is just her just laying on her side, but I thought it was a very cool x-ray to see all of the sharp little teeth that are in an opossum's mouth. Okay, and then we'll head back this way. This is one of our main treatment room areas. It's a fairly large room. Here we have Fred the ferret. He's just in for a visit. He said that he had a hurt foot, but when I took an x-ray, I told him there was nothing broken. So he's okay. He's just hanging out for the day. He'll go home later today. And this is just an example. This is Melody the puppy. As you can see, she has a hurt arm. This is what's called a Doppler. Now, for some of our reptiles and for some of our birds, we use this for monitoring heart rates or even just checking heart rates. And you can see this is where it goes onto the patient, and you basically will put a little bit of gel right here and you put it directly over a blood vessel just like that. Okay. A stethoscope, always very helpful to look at our patients. Just like when you go to the doctor, our patients get listened to with the stethoscope. And then the thermometers. Sadly, for a lot of our patients, they will not take the thermometer orally, so we have to be inventive in other places. And then here we have our sweet little Robin. He was found out in the parking lot and he had an injured wing, so we decided to go on ahead and give him a little bandage. He should be better in the next couple of weeks, and then we'll let him go. But here's an example of some of the bandaging material that we use.
And is he sitting on a scale?
He is sitting on a scale. It's very important to have a weight to make sure that everybody is eating okay. And then this is our one of our incubators. It is a very old machine, but it does work actually very, very well. And you can see we have poor Sammy the seagull in here. Feeling a little down today, just needed a little bit of help, so we're just kind of supporting him right now.
Can you explain what an incubator is? So I always think of it as like an egg device, but this is different.
This was a human baby incubator that was used in the ICU. This has been converted for our purposes. It's got heat in it to kind of supplement for heat. It's a small area. We can also, you can see over here on the side, there's some holes here that we can use to run oxygen through. We can even place IVs in patients and run the lines out through so that it can hang outside. Very, very helpful, very important. So it's just a place where they can be kept quiet and calm, warm, and can be given extra oxygen in the event that they need it. And then over here is our laboratory area. We do quite a lot of blood work in-house. This is our chemistry machine. So this checks a lot of our organ values. And this is one of the rotors that we use to put some of the blood work in. And it just goes right into here. These are two different types of centrifuges that we have here. This is a blood gas machine. It tells us how our oxygen is doing and some of our special electrolytes. Very important to have. This is a blood rocker, so when we get blood samples we can put it on this and it helps to keep the blood sample nice and fresh and mixed for us. This does hematocrit, so this can tell us if an animal is feeling well or if they're hydrated. This is for urine, so we can check urine, see if there's any bacteria or anything like that in our blood or in our urine. And then our microscope. We do a lot with our microscope. We can check skin conditions. We can also do look at fish samples. I will do what's called scrapings on fish and we'll check for parasites. We do a lot of in-house fecals, which means that we're looking at poop for parasites.
Cool.
Okay.
We did have a question from Isabella, age 7. What kinds of things do you use the x-ray for? And for bigger animals that can't fit into the x-ray room, how might you get an x-ray for them?
Those are excellent questions. So for the x-ray, we will use if an animal has come in and they're either lame or they've injured their wing. So we'll bring them in here and we'll lay in here. We'll take an x-ray of them, just checking for wounds. We'll also check organ sizes to make sure everything's looking okay. We'll check their lungs. Now, obviously, an elephant will not fit in here. So we do have a portal machine that's right down here. It's been put away. But we do have a portal machine that can go out into the field and we can use that to take x-rays. These are our plates that we have. We have what's called a CR system. And it's something that goes in here. And this is our machine that processes the x-rays.
Excellent. Peyton, age 12. Do not worry that none of the animals are moving. They're all stuffed animals, so we're not showing you any actual patients today.
No real patients.
Which is a good thing to tell you as we head into the surgery room, maybe. Maybe we should have started with that.
Yeah, so this is our surgery room. I've taken some of the stuff out, so, but some of this should look very, very familiar, okay? We all go to the dentist to have our teeth cleaned, to make sure everything's nice and healthy. And the same goes for our animal patients here. When you go to the dentist, here's some of the instruments that they might use to help clean your teeth and to check your teeth, even to look at your teeth. And if we have a bad tooth that needs to come out, these are some of the elevators that we can use to take teeth out if we need to. And then here is one of our dental machines that we have. This is called an ultrasonic cleaner, so it cleans a lot of the tartar off of the teeth. And this, obviously we have a drill here, but this does water and air out of this. And this is a tooth polisher. So after we've cleaned the tartar off with this, then we want to polish the teeth, keep tartar from building back up again. And over here, so this is Callie the kitty. She's just in for some routine vaccines today and to have a microchip done. This is what a microchip looks like. So here's the inside this needle is a microchip. And this is what it looks like. And so when you turn the microchip reader on, you can scan it and there is the number. So a lot of our animals do have microchips in them. Some of our birds have bands. There's a few primates that have some tattoos, but most of them have microchips. So we've got our sweet little kitty here. This is just an example of some of the anesthesia that we have. She's just here for an annual routine examination just to make sure she's doing okay. We'll listen to her heart and her lungs. We'll put on a blood pressure here. This kind of monitors how our heart rate's doing. This is an EKG. When you're watching TV and you see on the TV the little machine that does the little pulses like that, that's what these do. Okay, and we just clip it to the skin. They don't clip very hard. And then this is what's called a pulse ox. Okay, you see that little red light there? That reads oxygen in the blood, and we put that on the inside of the ear just like that, and that will tell us our oxygen. And this is just oxygen to give to our sweet little kitty right now.
And that is coming out of this machine right here?
Yes, this is our anesthesia machine right here. We also have a small ventilator.
Excellent. We did have a question. Teddy had a great question, age 5. How does an x-ray work?
How does an x-ray work? Well, so the machine spits out a special kind of radiation, special kind of atoms, and they go through and it reads densities of bones and soft tissue. So the more dense something is, the more white it is on the x-ray, and the less dense it is, the more dark it shows up. So your lungs are going to show up a lot darker, more black than say your bones, which are going to show up nice and white.
Excellent. And I should have mentioned before, if you have any questions for our zoo vet about taking care of the animals at the zoo or becoming a vet or what it's like to be a zoo vet, now's your chance. We're with Dr. Lipanovich, who, how long have you been a zoo vet?
I have been a zoo vet since 2006, but I've been a veterinarian, practicing veterinarian since 2004.
And you have worked at a few different facilities.
I've worked at a couple of different facilities. I did a lot of what's called preceptorships when you're a veterinary student. You work as a veterinary preceptor, which means you go out to different locations and you follow and you shadow and you can learn a lot of hands-on experiences. I did a lot of different preceptorships at a number of zoos, such as the Phoenix Zoo, Audubon Zoo, Columbus Zoo, and then in Memphis Zoo. And then when I graduated, I did some private practice experience in Arizona, and then went up to the Denver Zoo and did a residency at the Denver Zoo. Then I was a solo practicing veterinarian at Dickerson Park Zoo in Springfield, Missouri. My husband and I decided we were going to do a change of pace and move to Oregon, where I was a contract vet with the Oregon Zoo for a little while, and a big cat sanctuary, Wildcat Ridge Sanctuary. And then we decided to get back into zoo business more full-time, and I have been at the Buttonwood Park Zoo for the last year.
Great. Sage, age 6, has a great question about this room. Mm-hmm. So, we do have some big animals that live here at the zoo and small animals. What do you do if an animal doesn't fit into the surgery room?
Well, that is an excellent question. A lot of my equipment does come with batteries. This machine here actually does have a battery in it, so if I needed to take it out of the field, I could. This machine is on rollers, so if I needed to take it out, I could. So a lot of our equipment does have batteries, so we can take it out into the field if we need to, which is very nice and handy. We even have over here, I'll pull it out maybe the next go around, is our portable ultrasound, and it is the size of a small laptop. So a lot of our equipment is very, very portable, and so we just try to take that out and bring it back in as good a condition as it went out.
Great. Carmen has a great question about the difference between training to be a wildlife vet versus a domestic animal and how that is different.
So when you go to veterinary school, you learn all species. So even if you are going to veterinary school and only want to do kitties and puppies, that's great. Fantastic. You still have to learn all species. So you're still going to learn horses and cows, and you will learn a lot of other exotic animals like fish, reptiles, birds. You're going to learn all species. Then you can have a specialty or a track, which means that that's more like what you lean towards. But at the end of your 4 years of veterinary school, you will still have to pass the national board, which means you're going to cover all species. So you still have to take an exam on everything. Now, once you're out, you can say, okay, I have my doctorate in veterinary medicine, I want to specialize, then you can start specializing from there, and you can take class or take a course and do like an internship or a residency at a university or other facilities. So there's lots of different ways that you can take that.
Great, and that kind of leads into Hannah, age 8's question. How long did you have to go to school for?
So I did 4 years of veterinary school. I was early entry into veterinary school. So at Mississippi State University, which is where I went to, they have an early entry program. So I was accepted into veterinary school out of high school. I managed to get all of my prerequisites done at undergrad or regular college, and I did it in 4 years. Most people do it, in 3 years. Most people do it in 4 years, though.
Tegan is wondering what that beeping sound is that we're hearing.
That's the anesthesia machine, and it's telling me that it's not getting a pulse, and it's also not telling me that it's not getting a heart rate. And that's because our Steffi is very, very helpful, and our kitty is very, very sweet, but she is not really alive.
Yeah, she doesn't have a heart rate or breathing.
Rate.
Yeah. Oh, Emily, age 6, great question. Would like to know how you know when an animal is hurt or sick.
So the keeper staff are very good about knowing when their animal is acting abnormal. So sometimes it's just they have a decrease in appetite. Sometimes it's they're walking around and they've got a little bit of a limp to them. Sometimes they're holding their wings when they're normally holding them up nice and tight. Sometimes they're holding them a little bit off or even at a droop. So sometimes there's little subtle things that the keepers are really, really good at noticing because they look at them day in and day out. For several of our animals, such as the seals and the bears, we have trained them to do an open, so they will open their mouths and they can look at their teeth. And sometimes if an animal's got a weird appetite, we can look in their mouth and kind of do a quick little check to see if there's anything wrong with their teeth. So there's a lot of different ways, but the keepers are very integral in helping to maintain the health of their animals.
Great. Aria, age 9, wants to know, is there a type of animal that you have to give the most care to?
So I do feel like I see a lot of birds. There is a reason for the saying of bird brain. So I do quite a lot of birds here. That also seems to be one of the most popular animals that we have here. So I do a lot of birds as far as for that.
Sydney, age 11, wants to know, do you ever get bitten by the animals or have any worries about that?
So most of the time, especially if it's a bird, let's say like a goose, they certainly will bite you. It doesn't feel particularly good, but it doesn't break the skin. It really comes down to the keeper staff holding the animal really well, and all of us are very well trained in how to restrain safely. So most of the time it doesn't happen. Occasionally it does happen. Now some of our larger animals, such as the black bears or even the cougars or even the bobcats, those we do not necessarily look at and have in here unless they are under anesthesia. So they've been given an injection to go to sleep, and then they come into here, and then we can kind of look at them from here, and then they go back to their area, and I give them a reversal, and they wake up.
Great. Debbie has a great question about our vet care team. Who else do you work with? What other vet staff do we have here?
I am it as far as for veterinarians. We do call out for specialists every once in a while. I'm pretty well versed to do the majority of everything, but every once in a while it's nice to have help. So we do have a number of veterinarians that we will call in for assistance, such as ophthalmologists or even board certified veterinary dentists. As you saw from our post in December when we had the veterinary dentist out to help with the bears. So most of the time I don't generally call out for help, but we do have them. I do have a veterinary technician who is here on the days that I am not, and there are several days where we do tend to work together. Not right now. We're trying to separate us out for everybody's health and safety. And a lot of the keepers are actually cross-trained to be veterinary technicians on days that my technician is not here.
Great. Isabella, age 7, would like to know if you have a favorite animal to take care of.
That is probably one of the most popular questions that I get. I really don't have a favorite. I love all animals. I do tend to get a little bit more excited about reptiles, though. I think my keeper staff will definitely tell you that. And I think a lot of zoo veterinarians feel that way about our sweet little reptiles.
Yeah, Rebecca wants to know if being a zoo vet is stressful.
It has its moments where it is extremely stressful, and it has its moments where it can be very frustrating, but most of the time it's very gratifying.
Sarah, thank you so much for your donation. Your donations help us during this time of closure to keep our education and conservation missions alive, so we really appreciate that. Jen has a great question about, do you have places where animals can stay here overnight? Do they ever visit the vet for a longer period of time?
That is another great question. We currently actually have a bird that is being hospitalized now. It did manage to break a toe in its foot. So we do have him, he's in the back, which is why we're not showing you in the back area right now. But we do have a number of specialized cages. Animals that are coming in for quarantine from other facilities or even private individuals do come here, and they stay for anywhere from 30 to 90 days depending on the quarantine length. And they are here just for that time frame, and then they go back out. So the minute that an animal is healthy enough and stable enough to go back out and even be maintained or treated out in its exhibit, that's what we do. This is not meant as a long term. This is just a short term, just like for regular humans. If you are not feeling well, you go into the doctor once you are stable enough to be taken care of on your own, or to have help from family members, then you go home. So that is the same adage that we have here.
Andrea, age 8, would like to know if animals can have allergies like humans.
They sure can, actually. You can have a wide variety of allergies, anywhere from food items, believe it or not, to allergies, contact allergies, the pollens and things like that.
And how would you treat that?
We do use a lot of over-the-counter antihistamines. Sometimes we will use specialized diets, depending on the allergy that we have. We will maintain them also on a lot of vitamin supplements to try to help balance out a few different things if we think that there's an imbalance somewhere.
Great. Debbie, thank you so much for your donation. Their
that at least once a year. That means that they're getting a full physical exam, they're getting x-rays, they're getting, if it's a beak looked at, they get their beak trimmed if it needs it. If it's teeth, we get their teeth cleaned, all of that fun things. They'll get their vaccines at that time. We'll do blood at that time. We'll even do some different titers and testings of certain things. Check their urine if we can. Some of them come in and they've already PP'd for that day. And just kind of do an overall health checkup on them at least once a year.
Great. We had a question about what is the hardest animal you've ever taken care of?
I would say probably my larger hoof stocks, such as giraffes. They tend to be, they can be very skittish, very shy, so they can be very difficult, and they also are very specialized in what they eat, so getting medications into them at times can be incredibly challenging.
Sarah Beth, thank you so much for your donation. What kind of surgeries have you done? Ryan, age 12, would like to know.
I've done a lot of different surgeries, and I think my keeper staff and upper management will tell you that I am a surgeon at heart. So I love to do surgeries. It's one of my favorite things. I have done anything from spaying and neutering to exploratory surgeries on animals, and I've done emergency surgeries. We've done tumor removals, amputations. We've done a lot. I've done a lot. I love surgery.
We have a question about what kind of pets you have at home.
Yeah, sure, no problem. I have 2 dogs right now. I've had dogs and kitty cats. My dad was the director of the Memphis Zoo, so I grew up going to the zoo. So I always kind of felt like I had plenty of exotic pets. My dad had black swans, miniature zebu cattle, horses. We kind of had a slew of stuff. But right now, my daughter and husband and I only have 2 dogs. We will probably get a kitty cat at some point again.
Archer, age 6, is a great question about caring for water animals, like fish and seals and things like that.
Yeah, we do a lot of that. The seals are trained to do a lot. They can come out onto the water. They will lay on the x-ray plate, and we'll hang the x-ray over them, and we'll take x-rays that way and kind of look at their lungs and their abdomens. We can also draw blood from their flippers, and we will also give them their vaccines, so they're trained for that. Fish, I have done fish surgeries. We do that here. I have specialized equipment set up in the back for that. We do any fish that comes in does go through a quarantine period, and we do exams on them before they leave and go out to their new cages or their new exhibits when you come to see them. And yeah, we do a lot of that. They don't necessarily get vaccines though.
How does it work? So this is a question from me. A fish, and if you had to do surgery on a fish,
Yeah.
do you put them under anesthesia? Do they keep breathing?
Yep, they sure do. Oftentimes they do go in an immersion bath of an anesthetic, and then they are laid out on a moist kind of towel or foam, and then we'll kind of do a gentle little cleaning on the area that we're going to do the actual surgery. And we will actually run a pump with the anesthetic water through their mouth, and then it will slowly run anesthetic water through while we're doing the surgery. We actually will, the Doppler that you saw out there next to Melody the puppy, we will put that over their heart and monitor them that way. And at times, depending on how large it is, we can even use the pulse ox to monitor oxygen saturations. We can draw blood from them. We can do a lot of that.
Great.
And we do take x-rays with them. So some of our smaller fish and things like that, we can put them in a Ziploc bag with a little bit of water, lay them on the x-ray plate, take a quick x-ray, and then we can take them and put them back into their water. It takes less than 10 seconds. It's really, really quick, minimally invasive. I can also do an ultrasound with them too.
Wow, see, I learn something every time I do a virtual keeper chat with you guys. Great. I think we've ran through our questions. I think you showed us our vet hospital, which was amazing. Dr. Lipanovich is amazing. She does a lot of great stuff here. She takes good care of all of our animals. So I want to thank her for introducing us to her world and showing us her clinic. If you missed any of this or you missed the tour, be sure to watch the video after we post it, and you can see all of her equipment and all of her things. You guys had great questions as always, so thank you for that. And thank you to those of you who donated. We really appreciate your support during this time when we are not bringing in revenue with programming and things like that. I'm going to go ahead and finish this off. Thank you, Erica. Thank you, everybody.
Thanks so much. Stay safe.
We'll see you tomorrow at 11.